Thank you for everybody who's here already, everyone who's still logging on. Let me do some quick introductions and housekeeping before we get started. So my name is Monica Frenden-Tarant, and I am joined in this webinar by someone who needs absolutely no introduction to anyone on this call, the amazing Dr. Julie Levy. And we're going to be doing feline leukemia testing, one and done for everyone today. Thank you to our hosts for this webinar, Maddie's Fund. We've got Allison Gibson, who's going to be helping behind the scenes with any of the tech snafus we run into. And we have Cameron Moore from Million Cat Challenge, who is your moderator for this webcast. She's going to be managing all of the questions that people submit. Allison is also going to drop in a link to the chat for the Maddie's Pet Forum. If you do have questions at the end of this that Dr. Levy and I have not been able to answer, please go to that Maddie's Pet Forum link and we will continue this conversation there, and you can all engage with each other and talk about the greatest cats in the world, our FeLVs. So feline leukemia testing, one and done for everyone. Let's see if I can get my screen to cooperate. There it goes. Okay, really quick update before we get into everything that we're going to talk about and overwhelm everyone and confuse everyone along the way. Here's some fast leukemia facts and some updates for 2021. We know that there's a 2 to 4% prevalence in the United States for feline leukemia. And you can see on that map how it varies a little bit. Not surprisingly, higher rates of it in the South, I think because the Northeast has done a lot more spay and neuter than the South. It is not possible to determine a cat's infection status based on testing at any single point in time with any test. That was a big revelation that all of our studies kind of really cemented, was that the feline leukemia infection may ebb and flow over time. It may change, and any test is a snapshot of what is happening in that cat today. It can change. We know that leukemia-positive cats can be safely housed, sheltered, and adopted with great success. We're going to talk a little bit about that. I think the fact that we have almost 1,400 people registered for this webcast is indicative and proof of the statement that feline leukemia cats can be housed, sheltered, and adopted with great success. The fact that there are so many of you registered for this is beyond humbling, and it tells me that, oh my God, people care. People care about leukemia cats. So if you think you can't do this, you can. Remember this, that this many people, including like 700 vets, are registered on this call. We can do this. There is demand for these cats. We know we can do it. Leukemia adoption programs, in fact, are now the norm in shelters. That's a huge change, but it is now the norm to be adopting these cats out. We're going to talk about this a little later. We still don't know how long a naturally infected feline leukemia cat lives. We can't say what their average lifespan is, but I promise you that we're working on it. On the foundation of the giant study Dr. Levy and I started in Austin 4 years ago, we are still tracking those cats and how they're doing, and we're working on it. We're going to get you a better answer. But we do know that for a whole lot of them, they're doing really well years down the road. Lots of shelters are not testing for feline leukemia anymore at all. And we're going to talk about why that is, but it's okay. So if you're one of those shelters who's not testing at all, it's okay. We will support you in that. What we can absolutely reiterate, though, without argument, without controversy, there's absolutely no reason we should be euthanizing a positive cat based solely on a blue dot. We can absolutely guarantee you that. Okay. Retrovirus management guidelines have changed last year. The AAFP came out in 2020 with updated retrovirus testing guidelines. Important takeaways from that was that FIV and leukemia testing is optional in shelters. Recommendations for tests, we recommend that cats who are co-housed be tested, cats who need a diagnostic, but standard testing, blanket testing for everybody at intake may not be required for everybody anymore. The AAFP guidelines started classifying a feline leukemia infection into categories. These stages of feline leukemia were documented, and they got broken down into abortive, regressive, or progressive. And that was new, and we're going to explain what those all mean on the next slide. We know that discordant cats move between those stages. So for everybody on this call, you've probably gotten those cats who are like, I'm positive this day on this test, and negative the next day on that test, and I'm back and forth. That's a discordant cat. Those are pretty common. Because testing is confusing, expensive, and each cat and situation is unique, the AAFP and Dr. Levy and I all say now that the best recommendation, our new recommendation for shelters, is a simple one and done testing approach. And you can get those AAFP guidelines at catvets.com down there. All right, we're going to start getting into the nuts and bolts of things here. So here are the stages of feline leukemia that are classified under the AAFP guidelines. And there's a couple more stages that get even trickier, but we're not going to talk about them for the sake of getting this done in an hour today. These are the three most common stages that you're going to come across in shelters or in practice. The abortive stage. This is great. This is the one that we would all ideally like. An abortive infection occurs when the cat's immune system eliminates the virus prior to proviral DNA integration into the dividing lymphocytes. Cats with abortive infections do not shed infectious virus. They do not develop clinical signs. For all intents and purposes, these cats have gotten rid of the virus. They beat it entirely. It's not detectable. It's not infectious. They're pretty negative. They're entirely negative. The regressive cat. Now we start getting into tricky things. A regressive cat has controlled the spread of the infection prior to secondary viremia. And this is somewhat new. These cats are at a reduced risk of shedding the virus and developing feline leukemia-related disease. Reduced risk, not no risk. Although these cats may have or eventually clear viremia, the feline leukemia provirus is integrated into the cat's genome. It results in a lifelong infection. The leukemia proviral DNA can be detected in blood by PCR. Whoops. Bring your shared window to the front. I'm sorry, I don't know what just happened here. There we go. Is it back?
Yeah, it looks great.
All right. Technical of the day. Where we were talking about regressive. So in those regressive cats, there's no antigen or cultural virus present in the blood, and the virus is not shed in saliva after these cats have undergone initial infection. Their immune system has, for all intents and purposes, suppressed the virus. When the cat is regressive, the cat is not infectious to other cats except by a blood transfusion or if reactivation occurs. Now the progressive cat. This is the other end of the spectrum. A cat with a progressive infection has undergone infection of the bone marrow, secondary viremia, and is at increased risk of shedding the virus and developing leukemia-related disease. Those cats have shorter survival times and commonly succumb to leukemia-associated diseases. So those are the three big stages: abortive, regressive, and progressive. Hopefully we haven't lost anyone just yet. Doc, I think this is your slide.
Yeah, so that's a lot. And that's what we try to teach our veterinary students. And even they have some challenges absorbing it all and remembering it over time. And based on what I hear from veterinarians, they also find that to be a little bit complicated and hard to hang on to. So we made this cartoon that hopefully makes it easier to imagine what's happening in the life of a cat with FeLV. So what this shows is the gray cat on the left gets exposed to the virus from an infected cat. And if he has a strong immune response, he can possibly clear the virus completely. That would be the abortive infection. Or he may suppress that virus to such low levels that we may or may not detect it. But even if we can detect these low levels, there have low levels of provirus, that's the DNA, and low levels of the antigen, which is what you detect on the in-office tests. And these cats are unlikely to shed virus, so they're not contagious to other cats, and they're unlikely to develop the diseases that we associate with viral infection. So they may live normal lives and not be a threat to other cats. However, if they have a weak immune response at the time of that initial infection, they don't control the virus. It spreads throughout the body and into the bone marrow. And if it gets into the bone marrow, it's going to stay with the cat forever. And these cats generally have high levels of DNA in the blood that we can detect with PCR and high levels of antigen that we can detect with those point of care tests. Now, all of that, and these cats are likely to shed virus. They're contagious to other cats, and they are the ones that we expect in general to be more likely to develop a condition like lymphoma or infections that they don't recover from, or wasting disease, and to have an earlier death. So these are two ends of the spectrum, however, and what makes it even more confusing is that cats can have a change in their immune system over time, so they can migrate, ebb and flow between these two categories. And that's why Monica said a test at a single point of time does not tell us what to expect for that cat over its lifetime. There are some cats that are infected and their virus is so well suppressed that we can't detect it. We get a negative test. And there's other cats that initially start out with really high virus that their immune system gets it together and suppresses it later, and they become regressive. So this is why this is so hard to hang on to. And it is the foundation of our new recommendations.
Okay, so given that, who should we be testing for feline leukemia? At the shelter, the recommendations are that we're testing co-housed cats and kittens. As a diagnostic, certain sick and injured cats and kittens should be tested. You can go ahead and test everyone if it makes sense for your organization and your community. And what I mean by that is we saw what the prevalence of leukemia was in the United States, 2 to 4%. So if you are spending $30,000 a year to test every cat and you get a handful a year, and we understand that feline leukemia can be safely contained in the shelter and it's not easily spread amongst cats who are not co-housed and cats who are neutered, does it make sense to be spending $30,000 a year to catch a handful of cats if that money can be better spent towards feline life-saving in another way at your organization? So what I like to tell folks in shelters is that if you are doing really good in your community, all the cats are safe, and you want to test everyone to provide better care, go ahead and test everyone. It's not going to hurt. If you are a shelter that is struggling and you are low on resources and you could apply that money towards more proactive things like robust targeted TNR and spay and neuter, that might be a better use of your funds than blanket testing everyone. And it is perfectly okay for your shelter to say, we're not going to blanket test anymore. We're only going to target test or test when we need to instead of testing everyone. So you can absolutely do that. If you're going to do that, though, we still recommend that you test co-housed cats and use that tool as a diagnostic to improve welfare for cats. And of course, there are shelters, a lot of your transfer partners may require a test prior to accepting the cats, so we understand that too. If you are a cat owner, everyone, you should test your cat via private practice, especially before introducing it to another cat. In fact, feline leukemia lends itself, and all retroviruses lend themselves really well to that client-patient relationship, that long-term relationship that the pet and the owner and the DVM have in private practice, so that can be successfully managed over the life of the cat in an in-home-like environment. So testing in the shelter is also very expensive. No matter what brand you use, it is very expensive. It's also a snapshot in time. So that test result that you get today at the shelter on intake may not be telling you anything other than what's going in that cat today. If the cat was exposed to feline leukemia within the last 30 days, that test may not pick it up. I'm certain that everyone on this call has gotten some sort of wacky test result, which is why you're on this call looking for answers. So you're familiar with like that one test may not tell you what's going to happen tomorrow. We know that leukemia transmission is very easily controlled through simple measures and routine cleaning. I like to talk about this as a very weak virus outside of its host. It dies in the environment within minutes. It is killed by the most common of cleansers. This is not Panleuk. This is not Parvo. This is not COVID. This is feline leukemia, and it is a weenie of a virus outside of cat. You are not going to pass it on easily through contact. It's not through fomites. It takes prolonged, intimate contact between cats to give feline leukemia or mating. So you aren't going to get it just by simple contact. You're not going to pass feline leukemia on your hands as a shelter worker, on your shirt. It's not happening. Dr. Levy put out a famous study years ago that I call the chain link study, specifically studying that a chain link fence is enough to prevent transmission between feline leukemia cats. And so we've known this for decades. I know a lot of us are afraid and we've got fears of spreading leukemia, but it's time that we embrace science and acknowledge that it is not easy to spread feline leukemia. That's simply not how the virus works. It can be contained. Okay, so what's not changed in these 2020 AAFP guidelines? AAFP, nothing has changed. It's still safe to house, care for, and adopt these cats out. We agree it's easily controlled with common sense precautions. The leukemia vaccine remains effective. We know that, but we still do not recommend it as a core shelter vaccine. And Dr. Levy, if you want to comment on when you do think it's appropriate, again, I would say only in private practice. But my take on it is, unless your cat is outside and at high risk, I wouldn't vaccinate. Dr. Levy may have other thoughts on that.
Yeah, I would chime in here and say there's a couple places where I do recommend vaccination, and I would say I've been a more liberal user of vaccines from the beginning for a couple reasons. One is a lot of people, when they get a kitten, have a plan for its lifestyle. It's going to stay inside. They're not going to have any other cats. And so we didn't vaccinate those kittens. And then a year later, they come in with an abscess, or they've given the kitten away, or they got 3 more cats that didn't get tested. And since kittens are more susceptible to FeLV infection, we eventually rewrote the guidelines to say that FeLV vaccination is considered core for kittens. And then I would give them a 1-year booster and then make a risk assessment. So the low-risk cats probably don't need to continue to get FeLV vaccines, and the high-risk cats that go outside, cats that live with positive cats, should continue to get those vaccines. Again, all veterinary care should be triaged for what's most important. It's often clients don't have the funding to perform everything we recommend, so we need to help them prioritize, and that may fall off the list, even for kitties that go outside. The other, in the shelter environment, we generally don't recommend it. There's a couple reasons. It requires several doses, and it's not effective until weeks after all of the doses have been given. And our goal is to move cats quickly through the shelter system, so they're not lingering in our care long enough to actually get the benefit of all those vaccines. It's also a pretty expensive vaccine, and most shelters that are working with cats have a problem with shortage of resources, and so we want to make sure that every dollar we spend is being spent really effectively. In the one exception I would make for shelters is long-term shelters or sanctuaries that are intentionally keeping cats in large groups together. That is where you could have FeLV slip in through a cat that has a false negative at intake screening and then live with large numbers of cats, which is more stressful and increases the risk of spreading it. So that is where I would vaccinate cats at intake against FeLV. And that should be exceptional because we, generally, most cats do better in homes or back in their neighborhoods with TNR than they would in a sanctuary setting.
So speaking of TNR, we can give you a definitive answer on the next bullet point here. We should absolutely not be routine testing our community cats that are coming in for service for spay and neuter services and then going back to the field. Absolutely not doing that. That's been longstanding a recommendation. So that is still the guideline. Do not routinely test those guys as part of TNR work. The IDEXX ELISA, the SNAP test, remains the recommended point of care test. APA, for us in Texas, we specifically recommend you do not use other brands, no other brand. And we can talk a little bit more if you have questions on the why about that. But we'll get into, so here are, based on the AAFP guidelines and all of our studies that we've done with Dr. Levy and Maddie's Fund and University of Florida, we've updated our testing guidelines in Austin this year to reflect all of those changes. And after many a long conversation with Dr. Levy on how to do this, because we have an enormous feline leukemia program, we have an enormous neonate program, and this was a really big deal for us to get everybody on board and change the protocols that we built. If many of you on the call have ever sent us cats, feline leukemia cats, we used to do serum testing and we had a whole method of doing things, and it all changed this year. So here's what our new guidelines are in Austin. At the top, we've got cats 6 weeks of age and older. We test everybody at intake because we have the resources to do so, but also because we have this really robust feline leukemia program and studies ongoing. So we do test everybody at intake at APA. We test them on intake using whole blood and an IDEXX ELISA SNAP test. If the cat is positive on that whole blood and IDEXX SNAP, we consider the cat as positive. We're done. No more testing. If negative, we consider the cat negative. We're done. No more testing. They go off to their respective adoption programs. For nursing or pregnant queens, we tested intake using whole blood and the IDEXX ELISA SNAP. Test all cats and kittens individually. You cannot just test the mother. You cannot just test the kitten. You cannot just pick one kitten and test. They all have to be tested individually. If positive, cat's positive, no further testing. She's going off to the leukemia adoption program. If negative, they're negative. They're going off to regular adoption. If results vary amongst the litter, we do separate the positives from the negatives. And that's something that you'll have to suss out at your organization. I get this question a lot about, do we separate the kitten from the positive mother if they're negative? And my advice is, if you can guarantee to keep that kitten alive without mama, you've got the neonatal team who can raise an orphan, then do separate. If not, you have to make that risk assessment of where the kitten is going to be better off if you can't raise her as an orphan. If the cat tests negative, but there's been known significant exposure, we'll retest that cat 30 days using the same whole blood and the new, the whole blood and the IDEXX. And a little aside down there in the corner, we quit testing for FIV entirely several years ago. So we only test for feline leukemia now. So those are our simplified testing guidelines. Here is the written protocol, and you can download that at the link on the bottom. So no more serum testing. You used to remember that after we got that positive on the SNAP test, we would then spin down blood and use serum in that IDEXX test, and we don't do that any longer. You can see on this that at APA, we do pool blood for neonates into one test. Big asterisk there, the AAFP nor Dr. Levy recommend that you do that. So don't do that. Don't do that if you can. We do it in Austin as a cost-saving measure because we have upwards of 3,000 neonates coming in every year, and we're trying to work with as little of a budget as possible. If that pooled blood comes back positive, we're going to retest everyone individually. But Dr. Levy would smack me upside the head if I did not put this in there, that this is not recommended that you do this. Test everyone individually. All right, so why are we doing this? Why not the serum anymore? How is this okay? So our research has shown us definitively that whole blood is the most sensitive and accurate testing media. The landmark study that we started 4 years ago in Austin was it set out to prove what is the best test, then brand and medium, and what is the most accurate. We did not get the answers that we thought we were going to out of that study. We got a whole lot more questions than we got answers. But what we did prove definitively and this has been shown in other studies, is that whole blood is the most sensitive and accurate. So way back in the day, we used to say serum is more accurate. That is not true. Whole blood is the more accurate and sensitive. And we know that IDEXX has the highest sensitivity and specificity of any point of care test on the market. It's the only one we'll use because of that. And we are not paid by IDEXX. I wish we were to say that in any regard. So whole blood and an IDEXX test is your most accurate and sensitive result, period. That is as far as point of care goes. So what did the serum do then? Why did we stop with the serum testing? What we think was happening was that the serum testing was weeding out the regressive cats. But for shelter purposes, we now consider regressive cats positive. So why would we keep testing? If regressive means positive, then we don't really need to run that serum test anymore. Because regressive cats are at that reduced risk of shedding, but not no risk. They can be reactivated and viremia can occur. So that risk of reactivation and viremia does decrease with time, but they can still replicate and reactivate over time, possibly lifelong. So it's safer to consider that regressive cat positive. So if we're going to consider a regressive cat positive, there's no need for us to run a serum test and try to weed him out from an abortive cat or a negative cat. Regressive just means positive. So positive is positive, they go to the adoption program. So even if the cat is regressive versus progressive, we're going to house them with feline leukemia positive cats. So you were once positive on a SNAP test. We assume that you are positive, period. You're going to be living with feline leukemia cats. We understand that you may be regressive and you may test negative in the future, but you're going to live with the other leukemia positive cats. A regressive cat cannot get more leukemia from living with progressive cats. So you don't have to worry about that. That's a question you get, like, isn't it, are we going to make it sick by putting it in with the really positive cats? No, it's not going to get more leukemia. If the cat ends up abortive versus regressive, the cat likely has an adequate immune response to remain leukemia free. So it's okay to put him in with the positive cat still. Those cats are still going to be adopted out as a leukemia positive cat. And our recommendation is to indoor only homes as a single cat or with other positive cats. And I know we're going to get questions in the Q&A now about, but can't I have my negative cat living with a positive cat if I vaccinate my negative cat? We get this all the time. I know many people are doing this across the country. I am never going to personally recommend that we deliberately house positive cats with negative cats, because we do know leukemia is a potential to be a fatal virus. So we can't in good conscience say, yes, go forth and integrate those kind of cats. We do know that lots of people are doing it. And I think that's a big difference between individuals doing that and making a decision based on your household and your cats with your private veterinarian, and shelters saying that as blanket policy that it's okay to do that. All right, confirmation testing. I giggle now. I don't know if you giggle now when you hear the word confirmation testing, Dr. Levy, but I giggle now because there really is no such thing. Oftentimes, there's just no such thing as confirmation testing anymore. Repeated tests often indicate discordant results. So you run a different test, a different brand on a different media with plasma or serum, you might get a different test. And 6 months from now, it might be different. And back and forth, back and forth, back and forth. This is what our big study 4 years ago started showing us. It's like some of these cats are just nuts, changing from month to month over different fluids. I mean, it was insane. So up to 25% of cats behave this way too. So you can run all the confirmation tests that you want. You're oftentimes going to go down a rabbit hole and keep getting discordant results anyway. And you may never get that answer that you're spending hundreds and hundreds of dollars now trying to get. The infection changes with time and circumstance. We saw this over and over again in Austin with our study cats. When their stress levels would spike, so would their levels of feline leukemia. It would suddenly, a cat who's been testing negative for months would get stressed or sick, and that they would test positive again. So time and circumstance does affect the testing result. The only way to determine the stage of leukemia infection is with a quantitative PCR test, which Dr. Levy is going to talk about next. I find those best suited for private practice because of the cost and because of this ongoing management of retroviruses and the fact that you may be even more confused once you get that PCR test back. Or reserve them for unique cases where extra investigation is really warranted. I don't think we should just be blanket testing everybody with PCR. It's much, much too expensive. I want to talk about PCR, Doc?
Happy to. So PCR is a kind of test that was developed way back in the 70s. And what it did was allow us to detect infections or other genetic problems that are present in very, very low amounts, undetectable amounts. And it does this by detecting a few copies of DNA and then amplifying or copying those copies over and over again until they reach a threshold that we can detect. And we used to run these on gels. And nowadays, pretty much everybody is using these real-time PCR, which is very automated. And you see a picture here on the left that shows the samples are in a plate and it's robots run these tests and they generate these curves. And in a kind of a nutshell, the way that the DNA is quantified is that it looks at how many cycles of amplification it takes until the sample can be detected. So if it takes a lot of cycles, like more than 30 cycles, before you can even detect any FeLV, that means there's not very much there to start with. On the other hand, if the signal arises really quickly after just a few cycles, that means there was a lot there. We amplified it and it popped up right away. Based on our big study that Monica referred to that we've been doing for over 4 years now, following a group of naturally infected cats, is we can actually set a cut point between the low level and the high level that segregates these cats into what we think of as regressive long-term survivors, Or if it's above that level, then we are calling them progressive, and they are more likely to have a shorter survival. Now, that is on average. So it's important to remember that. It's not that every cat with these numbers is going to follow lockstep. We have cats that maintain very high virus levels, and they are long-term survivors. And then we have cats that develop a disease when they seemingly have a low amount of virus. So when you submit for this quantitative DNA, which right now IDEXX in the US is the company that it's available from. Internationally, there's other companies as well. But they've used the data from our study to share with the results. So when you get a result from IDEXX of quantitative FeLV PCR, it will come with this interpretation that they detected less than 1 million or more than 1 million. And it provides you with prognostic information. However, even though this is a very, 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 very sensitive test, there are some cats that don't have enough copies of the viral DNA in their circulation to detect. So we can have negatives, false negatives on PCR as well. And this just gets into the morass of confirmatory testing. There's so many caveats where it can go wrong that you can continue to test and retest and spend money and time that you don't have. And especially from the point of view of a shelter where you're talking about doing what's best for the most cats. We can have situations where that SNAP test, that point of care test, is positive and you get a negative PCR test. And in that case, that's what Monica referred to as discordant. You don't know for sure which test is correct. And similarly, you can have a negative point of care test with a positive PCR test. That again is discordant. You don't know which one is correct. If the two tests agree, that does become a confirmation test. If both your point of care test and your PCR test agree, then we can say that cat most likely is truly infected or most likely truly uninfected. Now, there's some reasons why we don't just say do a combination of antigen testing and PCR testing on every single cat. That certainly would give us the most information, but it's complicated. For one is the PCR you have to send away, and it takes a few days to a week to get those results back. And we don't want to do anything to slow a cat's progress through the shelter. We want to trim off every day that we can, because shelters are very stressful places for cats. There is a cost to this package too that is a little pricey if you're doing a lot of cat testing. So depending on whether you have contracts with IDEXX for different kinds of laboratory services or a shelter discount, the package that does test for PCR and antigen in the lab will cost anywhere from $60 to $100, and that is before a veterinary markup. So that's the cost to the account holder. And as we've already been talking about, the results of the cat on one day may not be the results of the cat a month later or a year later. So trying to really pin down a status on a cat beyond any kind of insecurity is practically impossible. So for these reasons, we usually reserve PCR for managing cats lifelong in private practice. We have clients that just want to know everything about their cat. It's perfectly fine to test those cats or to try and go on a deeper dive for FeLV infection in cats that have clinical disease that are associated with FeLV but are screening out negative on their first sample, or special situations in shelter medicine. The kind of situations that come to mind for me is, for example, if you test 4 kittens in a litter and one is positive on the screening test, you can just wait, separate them, and test them all a month or 2 later. Some shelters want to know faster, and so they can run PCRs to get some more information on those cats. So the stage of infection doesn't change our management of the virus. We're considering these cats positive with a 1-in-1 test. And I think this is really a significant point to kind of pause on. In the old days, which sometimes weren't so long ago and sometimes are still here, The outcome of a positive test was a terrible event. It was an automatic euthanasia for a cat. And so it became very, very important to understand whether it was a true positive or a regressive infection or another status, because life and death decisions were being made based on that result. Now we're saying and recommending that these cats should still be adopted. We adopt them with precautions so that they're not going to live with uninfected cats, but we have a very positive and optimistic attitude about them. So the consequences of misdiagnosing a cat as positive are not as consequential as they were in the past. So this has really made streamlining our processes for life-saving in shelters much more practical.
So very simple. Here's our new leukemia flowchart of testing. If you remember the old days, it went 26 different ways and retest here and retest there, and then what happens on serum. This is the new testing protocol at Austin Pets Alive. If you test negative at intake on IDEX with whole blood, you're going to standard adoption. If you test positive on that same exact test on your whole blood, you're done. You're going to the leukemia adoption program, and that's it. We're not testing you 30 days later. We're not testing you on serum. We're not testing you a year later like we used to do. You're done. You get to be adopted as a leukemia cat, or you get to be adopted as a negative cat. Either way, you're going to have a live outcome and you're going to get adopted. But that's it. We've shaved off all kinds of money in testing, all kinds of time. The exceptions in the shelter, like Dr. Levy was talking a little bit about, known significant exposure before intake, but you tested negative, we will retest you in 30 days. And those highly unusual medical cases like Doc was talking about. When to order that quantitative PCR, if you're the cat owner who want to assess that stage, and there are lots of cat owners, I just need to know, I want all the hints, I don't care how much money, I have to have some sort of answer, it's making me nuts. Go ahead and order the quantitative PCR. And then you're gonna get this all the time. This cat is just really weird. We can't figure it out. All of us are going crazy in the shelter trying to figure out what in God's name is going on inside this cat. Go ahead and order the PCR. It might give you some clues, but be forewarned, this is a rabbit hole. You might not get an answer back ever. You might get an answer back today. And if you retest that cat next year, you might get a completely different answer. And I get these emails every day. Here's the test result, here's the test result, and they're back and forth, and someone is just, this poor cat owner is just desperate, looking for someone to say, you definitively have this. And that's not a thing that happens anymore in feline leukemia. Dr. Levy explained it really, really well a long time ago to me. I now think of it like herpes virus, where it can change. It changes on your immune status, how you're feeling from time to time. It can change just like the feline herpes virus. So that's a really helpful way to kind of think about it. All right, here's the fun, uplifting part of the conversation of the webcast, if we haven't yet. This was another study we did at Austin Pets Live based on outcomes of feline leukemia cats. And we've done, 2 or 3 of these studies now with Dr. Levy and her team in Maddie's Fund. You adopt these cats out when they pop positive. With the little blue dot comes up positive, adopt them out. And this is a few of the results from a study we did on adopter satisfaction for positive cats. And there were some really interesting things that prove what we had kind of thought anecdotally for years. But you can see people rated their experience living with this cat overwhelmingly as very positive. The impact of the adoption on their life was overwhelmingly very positive. We saw high attachment rates to cats. We asked the question, how was the health of the cat compared to what you were told it would be? And everyone said it was about the same or actually better. The health was better than you told me it was going to be. The one on the right is the graph that really speaks to me. It says, how likely would you be to adopt a leukemia cat again if you were in the same situation, but you knew now what you didn't know then? Would you adopt another cat again? And 73% said, hell yeah. And this was something we've anecdotally in Austin for years called FeLV fever. We often think of who would subject themselves to this? I'm going to adopt a cat that's going to die soon. And then, who would subject themselves to this? As it turns out, over 3/4 of people would subject themselves to this. And they keep coming back. And we would call it FeLV fever. A cat would pass away. They'd come back and adopt another leukemia cat and another leukemia cat. Now I want 2 or 3 at home. And we saw it anecdotally, and this proved it. People want these cats. They want to feel like a hero. They want to do good. That's why they're at a shelter to adopt an animal. And once someone learns that their cat, who is now the love of their life, would have been euthanized 5 years ago, or at many shelters still around the country, they become fierce advocates for these cats. They become donors and volunteers, and they come back and adopt them again, even though they've been subjected to heartbreak or they've lost their cat earlier than they would have liked. They would absolutely come back and adopt that cat again. Also, kind of interestingly, this study showed us that versus negative cats, our adopters of leukemia positive cats were actually more attached to their cat. They had higher satisfaction with the adoption process and the shelter, and they were happier with their cat on a daily basis than people who adopted a negative cat. So I think that anecdotally proves to us that the feline leukemia cats are the best cats in the world, and there's just no arguing it there. It's right there in science. You can access that study at the link on the bottom of the screen if you want to see all the fun questions that we asked. Dr. Levy put this screen in. Do you want to talk about this, or you want me to do it?
I did this because to me it emphasizes that we need to stop undermining our own efforts. I see a lot of questions in the Q&A about how do we get started? Nobody wants to adopt. We live in rural areas. We've tried to adopt these cats out and they stay in our shelter forever. And we certainly, Monica can chat with you one-on-one to review your FeLV adoption program and give you tips. But something global that I really like when I visited Austin Pets Alive was a few things about how they feature them. So if you just go to the Austin Pets Alive website and you start searching and filtering on different things, if you click on FeLV, you get these really like enticing, nice profiles about the cats. And then if you click deeper, you actually learn all about the cats and their personalities. And the FeLV is kind of something to discuss later. So it's very transparent. You know that you're talking about cats with this virus, but they don't lead with that. And then in the shelter, when I was visiting, they had like a concierge matchmaker program. So you could go in and either wander around the shelter and look at hundreds of cats and get kind of overwhelmed, or you could schedule an appointment with a matchmaker and put some criteria in about what kind of cat you wanted. So if you wanted a lap cat, that likes other cats and gets along with dogs, or like all these criteria, the matchmaker would pre-screen for you and then take you around to meet the kinds of cats that met your expectations for a good pet. And they would lead with that and say, like, introduce here to Butters, one of our FeLV positive cats. And the FeLV discussion would become later. It's like, here, sit with the cat, meet it, see what you think. Okay, let's talk about what's going on with this cat. He's got this test. This is what it means. And they gave great adopter support, including follow-up medical care for any conditions that were related to FeLV. And it was very much within reason. Like, they weren't treating lymphoma and things, but they would provide good comfort care. And that, I think, is one reason why these FeLV adopters were happier than general adopters, was they really got a concierge service one-on-one, and they were not left feeling like they were going to be out in the cold. So the cost, Monica can remind me, it was something like $40 average a cat when they had medical care. So it wasn't like, this was going to break the bank to offer that protection.
Yeah, and only 30% of the adopted cats ever come back to us for medical care. And again, we're not doing chemo for lymphoma. We're providing doxycycline and Metro and the same standard of care that other cats get. But that has been one of the great successes that we've made in the Feline Leukemia program at APA, and I'm so proud of our leukemia team there on the ground. It is concierge level service. We did that very deliberately. When you adopt a feline leukemia cat, within 24 hours, you're going to get an email that says, "Hi, my name is Kelly. I am your feline leukemia concierge at APA. You need anything, you have any questions, you come to me. I will find you the answer because I'm the feline leukemia expert here. If I need to go ask a vet, she's going to do that. But she is your point person. You're going to get an immediate response right away. They know these cats. They know the adopters. You do get concierge service there, and it's made a huge difference. It's made an absolutely huge difference. We've got a sign behind our adoption counselor desk in our cattery at the shelter that says, "Think FeLV first." So when someone comes in and says, "Hey, I'm looking for a cat that is X, Y, and Z, and they don't have any other cats at home," we're going to go with, "Let me go take you to the Leukemia Adoption Center." or show them the leukemia positive cats that are in the regular adoption center, because we do that too. You can absolutely adopt these cats out. I promise that people are looking for them. You can filter by them on our website because so many people are looking for them. So you don't have to weed through 1,000 cats looking for the feline leukemia positive ones. And Dr. Levy was talking about our cat matchmaker program. We actually have a self-guided course on that through Maddie's Fund. If Allison can find it, and she'll throw the link in the chat for you, where you can take that free self-guided course to learn about our feline matchmaker program that helps get these harder to adopt cats into homes. Yeah, it's all about marketing. It's all about being transparent, explaining to people what it is, not scaring them, taking the fear away, and then letting them be heroes and love cats. Okay, this one's for Doc too.
Okay, so we've talked a little bit a few times referring to our big study. And our goal way back over 4 years ago was to solve once and for all the puzzles of FeLV testing. We thought if we could identify a group of cats and run every single possible test on them every month for 6 months, at the end of that enormous effort, we would have the answer that we were all craving, because we were very dissatisfied with the uncertainty that all of us have experienced in practice and in shelters. So because Austin Pets Alive has this amazing FeLV program, we designed a study. It was funded by Maddie's Fund and subsidized by all of the different test vendors. And we enrolled 130 cats that had a fresh diagnosis of FeLV. So not animals that have been in the system a long time, but incoming new cats. And we tested them with a very extensive panel of tests, including PCR, a couple kinds of antigen tests, IFA, and we tested serum, whole blood, and plasma separately. So we ended up with hundreds of thousands of test results. And the bottom line answer is we did not develop clarity about what the way to know exactly the status of a cat. It's unknowable. But actually what that did for me was freed up my compulsion to fight towards a definitive answer, because I know it's not available now. I know that there are a fair number of cats that are just going to defy clarity, and I'm good with that now. And especially now that I compare it with a positive outcome, regardless of what the result is. So what you see here on this slide is the 130 cats that we enrolled in our study. And based on that one intake blood sample, what the virus level was, the provirus with PCR, we could break them into several groups. So we had a group of cats that were uninfected. They were referred as infected, but by the time we got them, they had negative test results. So we called those uninfected or abortive infections. That's the green line on the top. And then we had another group which had low levels of virus on the PCR test. We called that the regressive group. And then finally, the progressive group had high levels of DNA on that initial test. And what you see here across the bottom is their follow-up time. This shows 3 years of follow-up time, but we're actually up to 4 years already. And then the survival probability on the y-axis. And you can see very clearly from doing that quantitative PCR on that very first sample, we make pretty good predictions about whether a cat is going to be a long-term survivor or in a group that has a higher risk of only surviving for a few years. So we're still following these cats. We're in their holiday check-in right now, so results are coming in. Most of the cats that were alive a year ago are still alive now. It does seem like if they make it past that early phase, that they're good to go for a long time, but we plan to follow these cats for life. So we'll, in 10 years, maybe have some more answers for you. We definitely know both from scientific studies and from our own anecdotal experience that reducing stress seems to be really important in giving that cat a chance to be in the regressive group and to have longer survival. So cats that are in homes outside of the shelter and outside of sanctuaries with few other cats in low stress situation will live longer and healthier lives than cats that are kept in confinement with lots of other cats. A whole nother topic we need to have is the new successful treatment for curing FIP. It's just amazing. I never thought we'd see this in our lifetime. Hopefully it's going to get easier and cheaper to do. But one thing that was unknown is, could cats with FeLV respond to this treatment and be cured? And the answer is yes, they can. Some of them needed a couple rounds of treatment, but we actually surprised a lot of experts that these cats can respond really well to the new drug treatment as well. But we still recommend, because we know that cats can transmit FeLV to each other, most especially among kittens, but even among adults, we do not recommend knowingly placing FeLV infected cats with uninfected cats. An abundance of caution to protect the uninfected cats is to keep them separate. If they're already living together, and I've got clients like that, when I diagnose FeLV, they've got 3 other cats, and I tell them they should segregate those populations, and they sort of smile politely and say, okay, and they really don't do it. So I would recommend vaccinating those other cats if you do have a mixed household.
So as I said in the very beginning, these adoption programs for positive cats are now the norm. Not to name and shame, but if you are still euthanizing based on that blue dot, you're the outdated rescuer shelter. I put a picture here of cats on the bus because the bus for Feline Leukemia is leaving. If you don't get on it, you're going to be left behind. We're getting there and have gotten there so much quicker with Feline Leukemia than we did with FIV. That took years to really combat and overcome in most shelters. We are there with Feline Leukemia. These programs are not wacky, crazy, newfangled. This only happens in crazy Austin. These are the norm now. Adopt these cats out. You can do it. There's huge donor, volunteer, and public support for these programs. People want these cats and they want them to live. We can't take every single leukemia cat in the world down in Austin, but we can help you set up a program. If we do accept cats from you in Austin, our transfer protocol has changed. We no longer require that serum test, but we are going to make you do an IDEX test. We are prepared to help you start your own program. We're working on a couple initiatives this year of launching a US Facebook page to list everybody's leukemia cats that are available up for adoption and start marketing them and promoting them professionally so that we get all the time people from states away that want to come to us to adopt a leukemia cat. We're like, no, surely there's some closer to you. We want to make that easier for people. So if we can answer any questions, our leukemia team is there to help you. You can reach out to them at any time. But there's our new transfer protocol too. If you have other questions, go to that link and Dr. Levy and I are going to answer them. But first we have a little poll that we're going to pop up. How comfortable are you with this one and done testing protocol, as we've talked about? Pop your answer in there and then we'll see what everyone says. Cool. All right. So 38% of people said we're already doing something like that. That's awesome. 39%, I'd like to try a protocol like that for us. 7% need to learn some more. 3% said I'm not comfortable with that at all. And 13% doesn't matter because we're not routinely testing anyway. So I think that's really encouraging. What do you think, Doc?
I'm really proud. And what I like is the diversity in our field. We can't make one protocol that is right for every organization, but we can try to do what's best for cats. And at this point, we're ready for Cameron to throw some questions at us. And I see we've taken up almost all of our time and that there are over 50 questions in there. So Cameron had her work cut out for her to find what was some common themes, but also we will be answering any unanswered questions in the forum over the next few days. So you will be able, if we don't get to your question, go look for it there.
A lot of really great questions, but I think many centered around the same thing. How do you decide that you should do a PCR test once you have that positive SNAP test? I think people are still really confused. And also we know that it's costly to do that. So when should we do it and when do we not need to do it?
Well, I would say for animal shelters, there's not a very frequent need to do a PCR test. As Monica said, we usually do it if we want an answer really fast, such as a mixed litter or recent exposure. We don't want to wait months to retest. Or if it's just a really confusing case that the veterinarians are trying to work through, the testing has been surprising and conflicting. It's one more way that we can get some answers for that cat. I think the PCR testing really has more applicability to the private practice world, where veterinarians are working one-on-one with their clients, trying to help an individual cat.
Okay, another question is, if we have negative cats in a litter, mom is negative, kittens are negative, and one is positive, do we tell the adopters of the negative kittens that they've been exposed?
I will tell you what I do, and then I'd like to hear what Monica does. I do believe in full disclosure and transparency. These are those cats that, like, oh, maybe we should do PCR on everybody because we're just so confused. You know, how did they get it? Mom is negative, and that happens once in a while. And most likely, mom has a regressive infection that we can't detect, but she's passing some virus-infected cells into her milk, and the kittens are becoming infected. Or if they're coming from the field, community cats often share mothering with each other and nurse each other's kittens. And so, you know, they might be nursing off a cat you don't know about. Kind of that's what I would do, is just provide all of the testing. But Monica, what's your approach?
Yeah, I think if we know something, we should provide that information and be as transparent as humanly possible. I think that's the ethical thing to do. And it's okay to say, we don't think this will impact your kitten. Science doesn't think it will happen, but this is the world of feline leukemia. It might, and while we don't think there's any chance of that happening, we like to disclose everything and be perfectly honest. So, you know, if you can keep track of that and just say in the shelter software account, like, there was a positive in that litter, I think if we know something, we should disclose it.
And as a reminder, at what age are we recommending that these kittens or cats be tested, and why not younger than that age?
Well, I can, again, it's different for different organizations. My approach was I test everybody at neutering age, because they're going to get neutered at 7-8 weeks and then get adopted like immediately there. So that's a reasonable time to do that all at once. I also didn't used to test underage neonates, orphans, and ended up missing some cats that then were positive at 8 weeks, and that caused a lot of problems with the foster caregiver, and also I exposed infected kittens to others. So my approach changed, and I started testing kittens as young as 1 day of age. But you can miss infections. They may be infected from their mother and not testing positive yet, and so I also retest them at 8 weeks. And you're still going to miss some.
We start testing at day old in Austin.
And do you find that the results are any different than, or any higher or different than if you just waited till they were 8 weeks?
We can't, because our neonates can't stay at the shelter. They have to immediately go out to foster. So we have to be safe and responsible, and not, like Dr. Levy was saying, we don't want to accidentally infect and expose. So what we do know from our big studies, that neonates have something entirely wacky going on with feline leukemia too, that we're going to hopefully do another study on sometime. But they're special little things.
Another question, and I know we're about out of time. There's so many questions, so everybody go to the forum and we can continue this conversation. But Monica, especially for you guys, do you recommend for a foster home to vaccinate their house cats, their existing cats, for FeLV as some kind of protection against their fosters?
Our fosters, if you were going to foster a feline leukemia cat, you need to have other feline leukemia cats or no other cats at home. Unless you are we know you as a foster, you've been vetted, we know you're responsible, and you're going to keep that leukemia cat away from your other cats. Those are pretty exceptional. Like our staff can do that, people that have been fostering for us for 20 years. But we generally say that you can foster leukemia cats or no other cats. You need to have no other cats in your home just to avoid that situation. But we would not recommend the leukemia vaccine in another instance. Just keep the cats separate. You're not going to give leukemia under the door.
I'd like to make one comment. I saw it brought up a few times about the brand selection. That based on our work we've done and some others, we do believe that the IDEXX SNAP test is the most accurate, the most sensitive and specific, but it is also more expensive and it's bulky and it has to stay in the fridge. If that test doesn't work for you and you need an alternative, a close second best would be the Zoetis witness test. It's a little card. You can get them sometimes cheaper, although your IDEXX distributor might match the price if you go to them. And it can be stored at room temperature. So in my opinion, the Zoetis witness test is an acceptable second choice. The one I would not recommend also belongs to Zoetis now, and that's the vet scan. And their whole suite of tests is problematic, in my opinion. Heartworm, parvo, everything else. We just have seen so many inaccurate results. So I hope that helps with that question.
Are we maxed out, Cameron?
I think we are. We're over time.
Yeah. This happens every time Dr. Levy and I present. In pre-COVID, we'd be like out in the hallway with a trail of people following us, but it makes my day. I love that this many people care about feline leukemia.
But the good thing is that we can all go to the forum and keep talking and discussing. And I think it's great too for others to share their situations and ideas as well.
Yeah. Cool. Well, thank you so much to everybody at Maddie's Fund, everyone at Million Cat Challenge for hosting and answering and moderating today. Thank you so much to everyone who joined. Please do join us on the forum so we can keep this going, so we can help you save more cats. I'm here to help you do that. Dr. Levy will answer your questions as best she can. She's got a couple irons in the fire as usual, but we're gonna make sure your questions get answered. Help does exist. If you want to start saving these cats at your organization, I will personally help you do it. I promise you that we can. Things are only going to keep getting better for these cats. We're going to keep learning more and more and become more comfortable with this. The fact that we had 700 vets on this call today is proof that we are making tremendous strides, and the time is now to get on the bus and join the rest of us who are adopting out these amazing cats. So thank you so much. Everybody have a great afternoon. Thank you very much. Thank you, Cameron. Thank you, Allison. Thank you, Doc.